Okay, so good night once again, everyone. Today is your orientation to the NCLEX RN program with Phoenix Occupational Health Solution, where our motto is transformation through education. And my slides would not share. So. Okay, so again, welcome. Sorry, that is supposed to be 2025. So this is, I want to tell you something about the company we established in 2020. This was just before COVID, and we offer courses as basic life support and with American Heart Association, as well as advanced coronary life support courses, first aid, CPR, and AED use for non-healthcare workers, and you do ECG, arrhythmia interpretation, and NCLEX preparation. So I'd just like to tell you something about myself. Most of you would have heard of me. I've been an RN for over 30 years. My name is Miranda Ramjatan. As I said, I'm a registered nurse with emergency and ICU experience, both at Southwest and North Central. I am a trained preceptor as well as a trainer for the customer service workshop at Southwest and an AHA instructor for BLS and ACLS, as well as I currently work as a district health visitor and I have a master's in public health. This is what I look like with a lot of makeup on. There's a pretty version of me. Hopefully we will meet sometime and we would have a more accurate representation of myself. So NCLEX course, that is a great question on most of your minds. So we go straight into it because I know you have a lot of questions about it. All right, so first item we have here IELTS, which is your English language exam. The local nurses may not have to use it, but for those from a foreign country like Nigeria, CGFNS may require it. We will see when we submit our application, then we will go do it. The last check I did, it was 2200 TT. All right, but it's only if CGFNS asks for it, then we will go on to do it. To send it, I think they have an arrangement now, so it's no longer 500 TT. The cost of IELTS to CGFNS is nil. They have an arrangement for it, okay? To send your results from one organization to another. To send it to the nursing board is 500 TT. To send it to CGFNS is no cost. They do it electronically. What is the cost of your CES evaluation? So this is your first step into getting registered as an RN in the US. We have to get your credential evaluation service done, where they look at the number of hours in your program and see if it is internationally acceptable to their standards exactly, and then they're going to accept you. So you submit this and they would give you forms to take to your nursing council as well as your School of Nursing to get your transcript done. For those of you in Trinidad, Nursing Council, it is 750 TT. There is a cheaper service of 450 TT that they sell via registered mail. That takes anywhere beyond 10 days and more, 10 to 12 days to get to CGFNS. And the length of time that Nursing Council takes to even send it across in the first place, I would advise you to pay your 750 and have it go across within 2 to 3 days. Nursing Council takes 3 months, up to 6 months. One person took 8 months. She almost had her CES service expire, and we had to call CGFNS and help her with that. Your transcript from CoStart is usually 15 US. For those of you who are CoStart students, there is an online website where you have to create an account on their student page with your student number and make the request. All right, so I will be assisting with all of these things. For the nurses who work in Nigeria, you contact your nursing council. I think they're a little more proactive than Trinidad and Tobago. Now, after you get your CES evaluated and it sends off to your nursing board, we have to get your finger print screen by the FBI, and that is a cost of 44 US to you, as well as your sending the fingerprint cards from Trinidad. You have to go to the police station here, get your fingerprints done. There's no cost attached to that. You're letting them know it's for foreign employment. It's not for a certificate of character, and they will do it free of charge for you, and then you have to mail it. So they usually have sales with FedEx and DHL. So you're going to check them how much is going to be sending it across. You want to send it via secure mail, not registered mail, right? So you want to send it quickly via DHL or FedEx, and that's approximately 500 TT. Your NCLEX exam is 200 US. All right. Your flight, you have to take into consideration where you're going and who you're staying with, or if you are doing it in North America or some other country. There is talk now by NSBN, who is the preparation body for NCLEX, of having it done online. So you could be in your home and do it. Of course, they're going to have checks and balances that you cannot cheat. Okay. Now, my part of the fee, so all of those fees are the process fees. Tuition fees is $4,500. It's a process of 6 to 7 months. It depends how many particular weeks in a month, and public holidays like Christmas and stuff. So my thing is, we are not going to be hosting for Christmas because everybody's shopping, everybody's cleaning, and very much distracted in the month of December. If we do have one class, it will be the first week in December, but everything else, everybody is busy. And this is from past experience with other classes. We normally have to reschedule. So the tuition consists of 32 lessons, right? So that's 32 weeks. But in between, I will be doing questions with you. So it's going to take more than 32 weeks, say about 32 to 35 weeks. All right. Not counting any of the public holidays like Christmas and New Year's, because that's a time when everybody spend with their family. Your registration part of it is 500 TT. So your total cost to me is 5,000 TT. And all the other costs is graded in steps. So the first fee that you have to pay is my fee, right? Then the next fee I would advise you to pay as soon as you can, and you have to have a credit card to pay your US fees. If you don't, I use my credit card for you. You just deposit the money into my account to give me the US and I use it, okay? So it's 485 US. That is this fee here. And the reason I ask you all to do this as soon as possible is because nursing council takes forever. They do. I have a student who is still waiting for her license verification to go to CGFNS. It was supposed to be delivered last week. She has to update me if it arrived, and she has finished the program. The goal of the program is, while all of this is happening in the background, you are prepping for NCLEX. So by the time you finish the program, you are ready to go to NCLEX. You don't want to fall off and lose steam. It is a long program, but it is designed that way because you all are working people, you all have families, and you're going to find that even with the weekly assignments, you're going to find time. You're not going to find time to do it, but you are invested in yourself. You're investing in your future, so you need to invest your time. I can be the best teacher in the world, but if you do not adhere to my advice and you do not do the work, you're not going to pass NCLEX exam. It's unlike any exam that you may have had before. All right. Any questions on this slide so far? Anyone? Please make it interactive. This is where you get to ask your questions. No questions? Okay, so we move on. So what exactly is the NCLEX plan? It's the learning materials that will be sent to you via PDF document. This is the lesson every week. You can print it if you wish. You are getting it via PDF, all right? You are required to study materials. So we go through the same PDF that you get. We go through it. I give you what are the NCLEX tips, what NCLEX is looking for on each particular topic, and we do some questions. On that paper, it would have some questions, okay? So students are required to do the quiz on the material. So after we do the presentation in class, And the questions in class, we're going to have an entire class on strategies to answer questions. And each week we cover a particular topic. And after that topic, you would be sent questions. So if we do psychiatric conditions, we're going to send you questions on that. If we do neuro, we're going to send you questions on that. And you are required to complete the question. The question is, okay, it's going to be sent via Google Doc for you. It's only be open for a portion of time of 1 week. So you have 1 week in which to answer these questions. So my advice to you is you find a day, or you can do 5 questions a day. 7 by 5 is 35. So if you do 10 questions, say 10 questions a day, it's usually a minimum of like 60 to 70 questions. So if you do 10 questions a day on your lunch hour, because for the next 6 months, you have to be eating, breathing, sleeping NCLEX if you want to be successful at the exam. If you leave all of this, if you come to class or you accept all the questionnaires and you don't come to class, when time for exam, you're going to get overwhelmed by the amount of the materials that you have to cover. That is why it's spaced over 7 months. Okay, so you come in, if you learn one thing new for the day, it was one more than you knew before. So you're going to get a lot of information, but choose one topic and learn something about it, or let something resonate with you. And we're going to change the way we think because you're going to be practicing in the US, and they want critical thinkers. They don't want just doers. They want people to think about the condition, what is going to happen next with the patient. And that is why the NCLEX exam is designed the way it is. And we're going to discuss that in a little while. Now, again, most of the materials will be a lecture discussion if you all participate. And I always encourage my students to ask questions about the materials. So this is the plan outline that we usually do, right? So your first class, we look at, well, you don't have much lab values. You will not be tested on it, but there are certain lab values that you need to know as a registered nurse, like a metabolic panel, right? You need to know your electrolytes because everything affects the cardiac functioning. You would need to know it like at the snap of your finger. Okay, so this is a cheat sheet that I created that you're going to have. So anytime you need to refer to something like the therapeutic values of a particular drug or the toxicity values of a particular drug, you could refer to your cheat sheet. It's nicely put together. When you attend the class, you will see it. The psychiatric conditions and the medication are the second lesson that we are actually going to do. The reason I start with the psychiatric and neurological system first, in Trinidad and Tobago, we just have a 6 weeks part of our program that does psych. We are not so much tested on the conditions, but therapeutic communication and the side effects of the medication. One of the things that NCLEX always question you about is things that is going to make the patient worse or kill the patient. So that is just one of your first strategy when you're answering question. Which one of these options, if I don't do it or if I do it, is going to make the patient worse or make the patient die? All right. So they always like to test you on things that are going to harm the patient. So in psychiatric conditions, we don't really do a lot of the pathology of the conditions. It's mostly the medication and its side effects. And I have made it very simple in the table, the side effects and what they're looking for, the nursing interventions that you need to know. The second lesson would be the neurological lesson. This lesson is after psychiatric because the medications are similar, right? And the side effects are similar. Then we go on to the fundamentals of nursing, where we do an easy topic. We'll do ethical, legal, and cultural differences, medication administration. And then we start with the beginning family, antepartum, labor and delivery, and postpartum care. After postpartum, we look at the newborn. We do the assessment, the developmental milestones, vital signs, and play. All right, they like to test on it, the various theories of play and development. We're going to start the pediatric conditions after we finish the newborn assessment. So we're going to start off with congenital and genetic as well as cardiac disorders, followed by respiratory, endocrine, renal, musculoskeletal, neurological, integumentary, and GI. Now, I always put a hard topic followed by a soft topic. if you notice that, right? So your first two are hard topics, psych and neuro, and then fundamentals is basically what you already practice, but we're going to tell you about the cultural differences with the various ethnicities and cultures we have abroad. So you notice we have congenital, genetic, and cardiac. All these are linked. So we do it first, then respiratory, endocrine, renal, and we go on until we finish GI, right? We also have here immunological. We have lessons on procedure and skills, but I've changed that up a little bit. I have put it after the medical surgical conditions now. So you're going to have med surg followed by the pediatric and procedures and skills. And we're going to end it out with doing some UL questions on NCLEX, right? I will send them to you. You have the rationale. So the questions that I send, the questionnaire, they have the questions, they have the options, and at the end of it all, you have the rationales. So you go back now and you do a review of why did I get this wrong? And always have a pen and a paper next to you so you can make notations of your thinking, why you chose these questions, if you had no idea about the pathology or anything, so that when you go back through the rationales, you would see why your thinking was wrong or why you think it was correct, or if you just made a lucky guess. It is all part of the learning material. So don't spend a whole lot of time learning the material, and then a whole day pass and all you did was read through and you don't even remember what you read through. The questions are the most important part of the lesson plan because it helps you to develop that skill to answer questions. If you continue to just study, you will not have that skill to answer the question because NCLEX gives you two very wrong answers, the right answer, and then one answer is very close to the right answer. One word may make the difference, and you have to be able to decipher that. All right, so the skill is something that you have to develop, and the only way you're going to develop it is by answering the questions when I send them to you. Okay? So tuition, again, our learning materials, as I said, consists of a PDF soft copy. We use 4 materials that is condensed into a nice booklet for you, right? We use UWorld, Simple Nursing, and Saunders, as well as Mark Klimex. Before you go into your exam, we have the Mark Klimex recording as well as his book, so that after you have learned everything that you can, we sort of polish up your knowledge with these sort of cheat sheets. You know your stuff, but it's a reminder and a quick reminder. All right. And he's going to be telling you what to expect in the exam. So what are some of the benefits of doing NCLEX on your own? Most agencies, once you have done NCLEX on your own, remember they are making, when they sponsor you and they pay for your CES and all of that, they are essentially investing in you, right? If they're investing in you, they will not offer you a sign-on bonus. You do not have a foot to stand on to negotiate your rate of pay. When you do it on your own, you can choose which agency takes you, or which, not takes you, but which agency you want to work with, because you have an asset and they are offering bonuses. One company was offering up to 10,000 when they came to Trinidad if you already have NCLEX. But you have to look at the rate of pay. So while that person offered 10,000 US bonus, their rate of pay was 32. I think they moved to 34 eventually. Right? So you can negotiate with your agency and you move at your own pace of study. Again, I would advise you to stick with the program. Remember, when the agency is investing in you, you have to be on their program. All right. So I had signed up with MedPro way back in 2015, but at the time I was doing my master's, so I didn't follow through with it. But they were giving you a 6-month period in where you have to attend class, and if you don't attend class, they calling, they emailing and stuff like that. And at that point in time when I was doing my master's, I really couldn't commit to it. And then when I finished my master's, I went on to do DHB studies. So I end up not going with anyone. And when I wanted to do NCLEX on my own, I went ahead and did it. And this is how this business started. Because a lot of my colleagues, I do a lot of teaching in Southwest, even when I was an emergency nurse, I do a lot of teaching. And they approached me, a group of my colleagues approached me and asked me to start NCLEX tuition. And that is how the first group started, and it has been growing since then. So you all are group 7 that has joined into this program. What are the disadvantages of doing NCLEX? The cost is your own, right? You put out the cost. So basically, you're going to put out about $1,000 US to get your registration done. And then, well, you have 5,000. So that's 7,000, then my 5,000 in order, and you're going to do your flights. Hopefully, by the time you all are ready to write the exam, NSBCN would have it online so you don't have to go abroad. If you do have to go abroad, I help you select a place to do your exam. And I normally tell my students, if they're going across to the US, do not take the 8 a.m. exam because of the risk of traffic, and stay somewhere close to the NCLEX, the Pearson VUE buildings. So we look at what state you're going and we find a location and we help you book your exam. That is all part of the registration process. So as we go along the program and you all start the process, we would always be I would always be keeping you updated on what you need to do next. All right. So when I give you your forms and you send it off to the Innocent Council, you just give me feedback about if you made the payment and if you sent it off, so I know to tell you what to do and when to do it. So what exactly the NCLEX is? It's a computer adaptive testing. And what does that mean exactly? It means it tests you as the individual. All right. No two persons are going to get the same test. So when you go into Pearson VUE, they can drop you anywhere on a spectrum of questions, right? So you have to have a good knowledge of it. So some people, like in Trinidad, some nurses, their weakness is psych, their weakness is antepartum, postpartum, and labor and delivery because they don't have much experience or training in that. We only do a 6 weeks program in our program. I don't know for the bachelor students how much it is, but it is two areas that the weakness of Trinity students. All right. So anytime you drop into that, they're not going to give you a very hard question first. They start you off like mid-range, right? And based on if you answer that question correct, and you have various, I'm going to show you the various percentage of questions in the different topics in terms of safety, infection control, and stuff like that. So they're going to drop you anywhere on the spectrum. And based on how you answer that question, if you get it correct, they're going to go to a slightly harder question. If they go to the slightly harder question and you get that wrong, they will go back to the base. All right. So it adapts to you. So if you get a question wrong on, say, the stages of delivery, they will bring back a question on stages of delivery for you, but in a different format. Their computer adaptive testing is literally begging you to pass the exam. Because if it says, okay, she's smart or he's smart, I'm going to try a little bit harder. And then if you don't get that, they come back down to a lower level of cognition, right? Now, the goal is to achieve and maintain a certain level of degree so that the computer logarithm can evaluate your knowledge. So if you keep getting a lot wrong and they keep giving you easier and easier questions, so you know your minimum is 85 questions, your maximum is 150, right? Don't aim to pass your exam in 85 because it's going to throw you off. Anytime you pass 85, just say to yourself, I'm still in the game. Right? You have 3 hours and 150 questions in order to pass NCLEX, and they're begging you to pass. Once you pass 85, you're still in the game. If your computer cut off, you still have a chance of passing it. It meant that you did well. Okay, so don't panic. For in my case, it was 75 to 300 questions, and I reached 75, and my computer shut off, and I just went blank because I had a few questions that I wasn't too sure about, and I was just in shock. So don't psych yourself up to pass it to stop your exam at 85 questions. Just say, I'm still in the game. I am still in the game. I still have the ability to pass this exam. They're giving me questions. Okay. Any questions so far? All right. So these are the current, the before we had NCLEX New Gen. you had these questions such as the multiple choice, the select or apply, and the hotspot. So the multiple choice questions, you all are familiar with that. You get 4 options, you choose the most correct one, right? One of them. The select or apply, they have more than one option as the answer, and these can be tricky. So in my time when I wrote NCLEX way back in 2022, this was before NCLEX New Gen, if there were 3 possible answers and you only chose 2, you're going to get the whole question wrong. They don't do that anymore. If there are 3 possible questions and you answered 2, they're going to give you partial scoring. However, if it's 3 possible questions and you choose 4, you're going to be penalized for that extra one that you take. Right? So you can't say, they give me 5, I'm going to take the best chance and choose all of them. No, they're going to penalize you for the ones that you get wrong. So the trick to SATA right now, the SATA questions, is to choose the answers that you are only sure about. And when you do your questionnaires, I go through your questionnaires and I give you feedback. So if I see a trend in certain things with you, I will give you some feedback on it. All right. And if you know that select all apply is going to be your weak spot, because that multiple choice on the whole was my weak spot. I am an essay writer. I can write around the mulberry bush and back and pass an exam. But when you tell me about multiple choice questions, that is my whole weakness. So I had to train myself to make the right option. And it's always, they always tell you, go with your gut instinct. Don't change it. Your gut instinct, choose that one and move on. And when you start answering the questions, because you have over 5,000 questions that you would be receiving in that 7-month period, it's going to prepare you to answer any question. You're going to see your skill developing as you go along. You're going to be able to identify keywords, and the train of talking and thinking in coming to a rational and choosing your question, it's going to improve and your score is going to improve. So when you first start, you might be scoring like 30%, 20%, 40%, 50%. When you first start, do not hope to be scoring 70 and 80. If you do on a particular topic, wonderful, but you want to be able to develop that skill in answering the questions when you don't know the answer in order to rationalize it, okay? Then you have the hotspot questions, and these are like, they would probably give you the picture of the heart in a chest cavity, and they would ask you to identify where you would pick up Erb's point or the mitral valve sound. Okay, those are called the hotspots. You have fill in the blanks where you are given a question and you have a drop box where they will you have to answer. No, the fill in the blanks one is like they would do a medication calculation. So you would have to calculate the dose of a particular medication and enter it into the blank space. In the drag and drop box, you would have options on, and you're going to see pictures of these in a little while, right? You have options on the left and you have to put it in the right order on the right. So they might tell you, like, say, for instance, what is the order of putting on a pair of sterile gloves? That was an actual question that I got from my exam. So you have to choose the options on the right, on the left, sorry, and move it to the right in the right order. Then you have the charts or graphic questions, and this consists of an image as well as a text example. You'll be given an ECG rhythm. All right, so you'd get like a tachycardia, you could get a normal saline, normal sinus rhythm, sorry, or a ventricular tachycardia or ventricular fibrillation. For my particular exam, they had a sinus bradycardia. It's very rare that they will give you a normal sinus rhythm. And it was very close to normal sinus rhythm. You know, by practice you learn. And I said, you know what, let me count those boxes in between those R waves. And when I checked, it was actually a bradycardic rhythm. It was 58. And I know I got it correct, because if I didn't get it correct, they wouldn't bring it back. They would have brought back a rhythm for me. So you have to look certain things like that. It really, really looked like normal sinus rhythm, which is 60 beats per minute, but this was 58. So you have to be very careful. You have the graphic answer multiple choice, and this is same as the normal multiple choice, but it uses graphics or images as answers instead of text. All right. And then you have the audio video, and this is where you would have to listen to a sound or watch a video and then answer the question. And they normally do the heart sounds with this, and the breath sounds, right? The long breath sounds, whether it's ronchi etc. Now, the NCSBN's findings, they found that more and more RNs were caring for patients that are critically ill, and they needed to focus on this in order to reduce deaths of patients, all right? Because these are the critically ill patients that is going to cause litigation if they die. So the new NCLEX, instead of having a minimum of 70, and 75 and 300, they have now brought it to 85 and 150. However, 15 of those questions are pretest questions that are not scored. So your test taker can expect between 70 to 135 questions that is going to be part of your actual exam. Okay? So when they developed it, they look at the nursing care plan, right? The nursing process, caring, communication, documentation, teaching and learning, culture and spirituality. These are all things that you need to take into consideration when caring for a patient. So they develop the exam around that. In addition to the client need categories, these subcategories were your clinical judgment processes, which are explicitly measured by 18 case studies. That is 3 sets of items that are given with 6 questions. So these are your case studies, and this has actually made it easier for you to pass the NCLEX exam. So before you would have had 75 or 150 standalone questions, meaning each question was on a different topic. There was nothing related to the other one. But in your case studies, it's more real life scenarios that you would get. So for instance, you would get a question about a patient coming into the emergency department with chest pain and shortness of breath. They're going to give you the vital signs, and they would ask you in the first part of the question to highlight the things that the nurse would pay attention to first. So there is your critical thinking skill and what happened next skill. All right. And then based on that, they would say the doctor ordered this particular treatment. So it might be ECG, oxygen, cardiac enzymes, cardiac monitoring, and some medication. And they would ask you, based on this now, what are some of the things that you're going to be looking for? So of course, if you administer GTN or glycerin trinitrate, you have to be looking at the blood pressure, because GTN is given for chest pain with oxygen, but it causes vasodilation. So you have to look at that blood pressure. All right. So they would have contraindicated and indicated. These are parts of the questions that you are going to get in your case studies. So it helps you follow through with the care that you would normally administer for a patient, and not a standalone question, which just examines you on one thing. So in this particular slide, you would see how the exam is structured. So you would see percentages on this side and topics. So in the safe and effective care management, you see that this is the biggest part of the exam, right? One of the biggest part, the other part is physiological adaptation. So in the safe and effective care, you have the management of care, what you're going to do for the patient to keep that patient from dying or worsening, and your safety and your infection control. Okay, then health promotion and health maintenance is 6 to 12%. So this is prevention and maintenance. You have psychosocial integrity, where we look at communication skills and the patient psyche. You have another 6 to 12%. And then we go to physiological integrity, where we look at basic care and comfort, 6 to 12%. Pharmacological and parenteral therapies is another big part because of the side effects of the drugs, 13 to 19%. So things like the drug, they don't really ask you much what the drug dose is. If they need you to know, they would say, for instance, the pediatric dose is 4 milligrams per kg. They tell you that, but what you need to know is the side effects, right? Reduction of risk potential, 9 to 15% of your exam, and physiological adaptation, 11 to 17%. Okay, and the questions that I am going to send you are all broken up into these areas, right? Management, safety, health promotion, basic care and comfort, pharmacological. So you now get an indication where your weak spot is. If pharmacology is where you're getting scoring the lowest at, When I go into your questionnaire to review it, I can give you feedback on that, but I can only give you feedback if you do the question. Okay, and I would advise you don't wait a month before your exam to be doing these things for the first time. In order to pass your exam and to hone your knowledge, it is advisable that you answer all your questions twice. With me, I had a subscription to 2,500 questions. And because of my number of years experience, the fact that I am an ICU and emergency nurse, as well as I always keep my knowledge updated, it wasn't hard for me to do my questions, the 2,500 in 1 month. I did it twice in 1 month. But I took a month vacation and every day I answered 75 to 150 questions. I was in the States on vacation at the time, so if I took a day off to go sightseeing with my kids and stuff like that, I know the next day I had to double up on that. So the month before you schedule your exam, schedule your vacation time and put in that 75 to 150 questions and go through the rationale and make your short notes as well. So when you do it the first time around when we're doing this program, start making your short notes, your cue cards. So even though we have things in cue form and highlighted and stuff, you want to make your own cue cards on the things that are difficult for you to remember. And then with your cue cards, every day, learn one new thing. Do one new topic or learn one new drug and the side effects. It would be more than you know the day before. All right, any questions on this so far? Okay, so we move on. All right, so I would have told you about this slide, how it is different to the paper. It tests you to your ability. This is just going through it. So the another disadvantage is that if you guess in NCLEX, try not to do that because you throw off the computer adaptive testing, right? So the disadvantage is that guessing can artificially inflate the scores of low ability candidates because they can answer these questions item correctly 25% of the time, right? So it's 1 out of 4. You choose the correct reasons. And it have nothing to do with their ability. Instead, the NCLEX uses the CAT testing to administer the item so it adapts to you. So the CAT is able to produce exam results that are more stable using fewer items by targeting the items to the candidate's ability. So, you know, when you did CXC or O levels, everybody get the same question paper with the same questions, and one person might be very good at testing a particular type of question. So there are grades of the way they structure their questions. And you might be better adapted to doing a select all apply or a standalone or the pictorial or the audio visual, whereas somebody will not. So the computer adapts to you. It's begging you to pass the exam. The CAT is able to produce exam results that are more stable using fewer items by targeting the candidate's ability. And the goal of CAT is to determine the ability of the candidate in relation to the passing standard. Every time the candidate answers an item, the computer re-estimates the candidate's ability. And with each additional answered item, the ability estimate becomes more precise. The item is limited to the content area that will produce the best match to the test plan percentages, which is the percentages that we talk about. So if you find that they gave you a question on infection and safety, infection control and safety, and you got it wrong, they're going to bring back another question on that. You have to pass each one of those with a passing grade. So they find that like a person who came to me, she wrote NCLEX on her own. And again, she's a trainee student, so she didn't have much experience in maternity care. So most of her exam was on maternity. Another one was psych. Most of her exam was psych because that was her weak spot. And you have to pass with the minimum passing ability before they move on to another topic. So they will probably move you off of maternity and give you a PEDS question, but they're going to come back to the maternity question because you have to pass it. It is ensured that each candidate exam has enough questions for each content area to match the required test plan percentages. Regarding clinical judgment items, the 3 case studies and approximately 10% standalone items will be selected depending on the exam length. So the minimum of the new gen questions, the case studies that you're going to get is 3, right, with 18 questions. However, if you didn't perform well in it, they're going to bring you another one. So as I said, I didn't have new gen, but my weak spot was select all that apply. I must probably get like about 8 or 9 select or all apply in my particular exam, because again, that's my weak spot. So they wanted to make sure that I pass. An item or item set is selected that the candidate is expected to find challenging. So based on your past questions and based on the candidate's answers up to that point and the difficulty of those items, the computer estimates the candidate's ability and then selects an item or item set that the candidate would have a 50% chance of answering correctly. So again, it adapts to your knowledge. So they're going to start you off on an easy question. They're not going to start you off on a hard question because they don't know your ability. This way, the next item or item set should not be too easy or too hard, and the exam can get maximum information about the candidate's ability from the item or the item set. It excludes any item or item set that a repeat candidate has seen in a previous examination. So you are never going to get the same question if you repeat. They have hundreds of thousands of questions. You are never going to get the same question. The computer is designed not to retest you on the same thing. It would bring the same knowledge base asking, but not in the same format. So this is how you're going to know if you pass or fail. This is what the computer does to say, hey, this person is passing or failing. So the decision as to whether a candidate passes or fails the NCLEX RN exam is governed by 3 scenarios. Scenario 1 is the 95% confidence interval rule. And this scenario, the most common for NCLEX candidates. The computer will stop administering items when it is 95% certain that the candidate has abilities either clearly above or clearly below the passing standard. All right. The maximum scenario 2 is the maximum length. So you get your 150 questions or you get your minimum of 85 questions. And if at 85 questions, the computer say, hey, this person knows what they're talking about, it's going to cut off on you. All right. Then you have the maximum length of the exam, which is 3 hours. Some candidates' ability levels will be very close to the passing standard. And when this is the case, the computer continues to administer questions until you've reached a maximum number of items, which is 150 questions. At this point, the computer disregards the 95 confidence interval rule and considers only the final ability estimate. So if the final ability estimate is at or above passing standard, the candidate passing. If it is below, the candidate fails. So you go to your maximum 3 hours, right? So basically you have 150 questions. You have 2 minutes per question, 3 hours for the exam, and you have 2 breaks, which is counted in your time. So scenario 3 is the run out of rule time. So if the candidate runs out of time before reaching the maximum number of items, the computer has not been able to decide whether the candidate has passed or failed with 95% certainty, therefore they created an alternate rule. So if the candidate has not answered the minimum of questions, which is 85, you would have failed. So if in 3 hours you didn't reach question 85, they're going to fail you. All right. If the candidate had answered the minimum number of items, then the exam is scored using the final ability estimate, right? Computed from the responses of all the completed items. So if you reach 100 items or 125 and you reach your 3 hours, the computer is going to do that final ability estimate. If it is above, you're going to pass. If it's below, you're going to fail. So you might be a slow tester, but you're getting most of your answers correct. They're going to pass you. Okay? Now, similar items. Occasionally, you might receive an item that seems very similar to an item you received early in the exam. This could happen for a variety of reasons. For example, several items could be about similar symptoms, diseases, or disorders, yet it will address different phases of the nursing process, whether it's an assessment, a planning, a diagnosis, or evaluation, all right? Or an intervention, sorry. Alternatively, it can be a pre-test item, right? So this is one of, remember, you have 15 questions that they are testing. This could be one of them. It is incorrect to assume that the second item, which is similar to the content to the previously administered item, was administered because you answered the first item incorrectly. So when I did this exam, I didn't have the knowledge base that I have now to go and look all of this because I was working full time and I just knew I had to get this exam done, and I just bought a subscription and I was doing questions like crazy. So all these strategies and stuff that I will be giving you, I didn't have the advantage of that, okay? And I didn't know about it. So I got 2 questions on hospice care. So the first question, I chose that answer. And then when the question came again, I'm like, oh my gosh, did I just get that wrong? That's why they bring it back. It was a definition of a hospice type of care that is administered. But now I know it was a pretest item. Okay, so always select the answer you believe to be correct for each administered item, and all examination conform to the respective test plan. All right. So now if it's a pretest item and you get it wrong, you're not going to be punished, right? Because it's a pretest item. Now, rapid guessing can drastically lower your score because remember, the computer is adapting to you. So you know they told you when you wrote O-levels, if you have 5 minutes for the exam and you didn't choose any, you have some questions unanswered, just fill it out on your page. You don't want to do that for NCLEX because this is adapting to your testing. So if you just hit an A, just to finish the exam because you're on question number 60 and you're at an hour, 2 hours and 45 minutes, so you have 15 minutes to answer questions up to 85, do not guess, right? Take your time, go through it, read it fast, and choose an answer, but don't guess because you are throwing the computer off by guessing. Some test companies have realized that certain pencil and paper tests on unanswered items are marked wrongly, right? So this is why they have computer adaptive with NCLEX. On the adaptive test, it can be disastrous if you do that, and it has the effect of giving the candidate easier items, which allows the candidate ability estimate, which lowers the candidate ability estimate further, right? The best advice is to maintain a reasonable pace, spending no more than 1 to 2 minutes on each item, and to read each item carefully, choose out the keywords, and then look at the keywords in your answers. And the only way you can develop this skill is by practice. Okay, you give yourself 2 minutes to answer a question, but it could go down to 30 seconds. Once you know your stuff, it will go down to 30 seconds because you're looking at keywords. You have trained yourself to look at keywords in the question and keywords in the answer. Now, the new gen questions are based on the case scenario questions, the extended select all that apply drop down. So in a case scenario, you get between 2 to 8 questions from a single case, as I told you before, providing the patient record with several tabs and a split screen. And you're going to see this as we go along, right? So they give you a question, and then at the top it have a tab, and it would have the lab values, and then another tab would have the doctor's orders. All right, so each one of those tabs is information that you have to look for in order to make your judgment. In the extended select all that apply, you have longer select all that apply question with as many as 8 answers. So before select all that apply had like 5 options. Now you have up to 8. And a partial credit will be given for the ones that you chose correctly. The ones that you chose wrongly, you're going to be punished, right? You're going to deduct marks from it. The drop-down answers essentially is a cross between the multiple choice and the fill in the blank. And the questions will provide a drop-down list of possible answers to complete a sentence. Then you have extended drop and drag, and this is the traditional drop and drag, except for the fact that there'll be more answers than spaces. So before, on the left-hand side, you would have 5 options, and on the right-hand side, you would have 5 options, and you put them in the order that they're supposed to occur. Now they would probably give you 6 or 7 options, and you have to choose the 5 correct ones to put it on the right-hand side. Highlight the text. So this is the one I told you before, that when you're giving the case studies, they will give you the history of the patient, say for example, and you have to choose what you're going to focus on. So say for instance, the patient with the chest pain, you're going to see that they have shortness of breath, chest pain, then you're going to see the vital signs. If the pulse rate is over 100, that is something that you need to pay attention to. If the blood pressure is high or low, and you're going to highlight all the things that the question asks you to highlight. In this example, it would be things that you would pay attention to, right? The matrix or grid, and this is a select, like the select all that apply, but it's just more of a select or don't select. So for instance, you'd be given options, and you would say, for instance, like the medication that you administered, if it would be contraindicated or indicated, or they would give you a particular condition, and the signs and symptoms, you would have to say if it's indicated or contraindicated, meaning like say for instance, appendicitis, you would have fever, vomiting, or constipation and right abdominal pain. They might put left abdominal pain or generalized abdominal pain, right? So you would have to say take indicated or contraindicated in that particular case. Now, scoring the standard questions from the old NCLEX, that is the fill in the blanks, the multiple choice, the select all apply, and the hotspots, they will continue to be worth 1 point. However, multiple response questions will receive partial scoring. And in the new NGen style questions, partial credit is now given in 3 ways. You have the plus or minus scoring, dyad scoring, and triad scoring. So what are these? The plus or minus scoring, the test takers earn 1 point for each correct response and lose a point for each incorrect response. If the total score is negative, the final score is 0. So say for instance, there was 2 possible answers out of 6 options, and you chose all 6 options, you don't go to -4. All right? You would just be 0. You all understand that point? So if I select all that apply had 6 options or 8 options, and it was really only 2 correct answers, you chose 6, technically you'd be -2, right? If it's -4, but they wouldn't give you -4. They will just give you 0 because you made too many selections. In the dyad scoring system, the test takers take 1 point if both answers in a paired set are correct. In the triad scoring system, they get 1 point for each correct answer. And if all 3 are correct, they get 2 points. Okay? All right, so any questions so far of any of the things that I have said? You all have been pretty quiet. Anyone? Information was fully understandable?
Yes, I'm good so far.
All right, so if no questions, we'll move on. So I just want to tell you about the NSPN and NewGen. So again, we're going to define what is the clinical judgment model that NCLEX uses and review some NGN type prototypes, right? The objective is to discuss the judgment model and the prototypes. So in 2015, they did a strategic practice analysis on a pilot study, and they found that education regarding critical thinking, clinical decision-making, and clinical judgment had already become a standard part of the nursing curricula. All right, so 50% of novice nurses were involved in nursing error. 65% of the errors attributed to poor clinical decision making of what happens next or what I should do next and prioritize the care. And 20% of the employers were satisfied with the clinical decision making skills of nurses. However, it was of the importance of public safety that they review it. So again, clinical judgment is a necessary skill that the novice nurse need to have. How are we going to prioritize care if a patient comes in with chest pain and shortness of breath? We need to do the vital signs. We need to administer oxygen. We're not going to do the ECG first, right? The first thing we do, the patient is having shortness of breath, we're going to put them on oxygen. We're supposed to know how much oxygen that we are going to administer. It usually starts at 6 liters, or if the patient is the SpO2 is very, very low, we're going to start with the rebreather mask, okay? And then we're going to do the vital signs in terms of blood pressure, pulse, and cardiac monitoring. So we need to put that patient on oxygen because with an MI, he's not receiving oxygen to his tissues. So the client care in these areas can be improved by enhancing the clinical judgment skills in novice nurses. And there's a clear need for direct, extensive, and explicit assessment of this construct in entry-level nurses. So when they did their review in 2015, they came up with this. Assessing the clinical judgment is a critical component of the overall goal of NCLEX ascertaining a minimum competency in order to say that you can practice. And the clinical judgment currently is indirectly tested in a limited manner through integration across activity statements. So this was what they came up with in 2015, and they decided they're going to change the way the exam is structured. So the three predominant nursing theoretical frameworks for assessing the clinical judgment is the intuitive humanistic model by Benner, the dual process reasoning theory model, and the information processing model. So the clinical judgment model is a little bit difficult to define. So we're going to use these three in order to go on to the process. So you have your nursing process where you have assessment, diagnosis, nursing diagnosis, planning, implementation, and evaluation, where you have critical thinking and clinical decision-making skills in each one of the steps. With the clinical judgment, it is defined as the observed outcome of critical thinking and decision making, and it is an iterative process, that uses nursing knowledge to observe, assess the presenting situation, identify a prioritized client concern, and generate the best possible evidence-based solution in order to deliver safe and effective client care. And this is what the judgment model is. So you have your nursing process at the base here: assessment, analysis, planning, implementation, and evaluation. And on your assessment and analysis, you're looking at your environment, your client observation, what resources that you have available, the medical records, what past medical history of the patient, right? Consequences and risks that the patient has had. So say, for instance, the patient is a renal patient who is on hemodialysis. You're not going to do the blood pressure on the arm that has the, it would just slips my mind, right? That they have the arteriovenous shunts. Time pressures, what needs to be done right away, what can be put off for later. Task complexity, is there something within you? If you are a general nurse, can you go deliver a baby? Or in the emergency department, if a patient comes in labor, is this something that you can handle? Cultural considerations, and we're going to discuss all of that. Then in your implementation phase, it's based on your knowledge, right? Specificity, candidate characteristics, prior experience, and the level of experience that you have. So all those things are coming into your layer 4. In your layer 3, your ability to recognize cues, form hypotheses, analyze the cues, right? When you form these hypotheses, now you're going to redefine it and prioritize the hypotheses and generate solutions, right? So what would happen if that chest pain patient comes in and I don't administer oxygen? All right, so you want to prioritize what would happen if the chest pain patient come in and I do an ECG first, and while I'm doing the ECG, the man goes into respiratory and cardiac arrest. So you have to prioritize your hypotheses and generate your solutions, and then based on your evaluation, take actions and evaluate the outcome. Understand that? And that is your clinical judgment model. Your client needs and your clinical decisions and how you're going to implement the care. So focus is solely on the measurement of the clinical judgment, that it does not replace the current models of teaching or learning, and it does not replace the nursing process. It incorporates the nursing process. And this is the layer 3, which we just discussed. And again, recognizing cues is assessing the information such as the signs and the symptoms and the medical history. Analyzing it is linking the recognized cues to the client's clinical presentation and establishing probable client needs, concerns, or problems. You're going to prioritize your hypotheses, evaluate and rank your hypotheses, such as urgency, likelihood, risk, difficulty, and time, into priorities. You're going to generate solutions. That is, you're going to identify expected outcomes using hypotheses to define a set of interventions for the expected outcome. So if the patient with chest pain and shortness of breath comes in and they're diaphoretic, my hypothesis is I'm thinking this patient is having an MI. I am going to administer oxygen, put him on a cardiac monitor, vital signs first, and then cardiac monitoring, so that I have something to report to the doctor. So if you have to call the healthcare in NCLEX, we call them healthcare practitioners or providers. Before you call them and say anything, you need to make an observation and assessment. So the patient, your assessment is shortness of breath, chest pain, and diaphoresis. That's your first thing, right? So you'll create a hypothesis based on these 3 signs and symptoms. This patient is having an MI and he's not suffering from appendicitis. Okay? Take action, implement. So if he has an MI, I think he has an MI, we're going to put him in bed in a high Fowler's position, start the oxygen and start vital sign and SpO2 monitoring, right? Then evaluate the outcome. Did the patient improve with oxygen, right? Did his SpO2 go up? And then layer 4, this layer provides context of your clinical judgment, right? So the environment, if the patient was a patient in an area where it is hot, if it's cool, if it's safe, if it's unsafe, patient observation, which we talk about the signs and symptoms, medical records. Is this patient a chronic renal failure patient, right? Is this patient had a previous MI? Is this patient anemic? Time pressures, what needs to be done first, right? And then your knowledge, your specialty, and your experience. And as I mentioned before, if you are an emergency nurse and a delivery comes in, do you have the knowledge to assist with this delivery? Do you have the specialty as a midwife? Do you have the experience? Because even though if you're a trained midwife, you may not be able to handle complicated situations such as breech delivery. Okay, what resources you have available to you? Do you have oxygen available? If you do start it, do you have cardiac monitoring? You don't have cardiac monitoring, but you could palpate a pulse. All right, and you could tell if it's evenly spaced, if it's bounding, if you have various degrees of intensity. All right, and again, time pressure. Knowledge skills for your intervention. Can you do CPR? Do you know how to do an ECG, right? Candidates' characteristics. How do you feel about attending to a certain type of people? You have to know about you. Remember, you are professionals and you want to be able to adapt to the cultural sensitivity, right? Task complexity. Can you do a CVP insertion? Can you administer medication or administer care to a patient with a CVB? All these things are going to be tested in the clinical judgment model. So in applying the CJ clinical judgment task model in education, you look at the cognitive layers, which is layer 3, and factor conditioning, which is layer 4. You have expected behaviors or actions which are equivalent to appropriate student action or observable outcome. And the CJ model assesses if the student is able to make the appropriate nursing clinical judgment by following the cognitive operations throughout the entire case study. All right, to be able to think it through. And again, these are the cognitive environmental cues: recognize abnormal versus abnormal, the signs and symptoms, patient observation cues, recognize the medical records, and time pressure cues. You identify the history. All right, so all these are under cognitive. You analyze, you prioritize, you generate your solution, you take your action, and you evaluate your outcome. So these would be the conditioning, the first column, conditioning factors, and these are your expected. All right. So your environmental cues, if the man is sitting on a bench, you're going to move him into a bed. Your patient observation, he having some shortness of breath, chest pain, right? Medical records. What is his past medical history? Did he have a previous MI? What type of MI? Inferior infarct, posterior infarct, right? Time pressure. He is short of breath and cyanose. I need to put this man on oxygen. All right. And then you analyze the cues. That's what we were doing before. And hypotheses. This man is having an MI, right? Your vital signs. You're going to check that blood pressure, that pulse, if it's tachycardic or bradycardic. Knowledge of the conditions. You're going to generate solutions. So you see shortness of breath, chest pain, cyanosis. You know this man had a previous MI, so he's a cardiac patient. So therefore, this man is probably having an MI. Take actions. What do we do with an MI? You start the oxygen, your vital signs, and whatever. You call your doctor immediately. You know, you have to take blood, so the patient has to have two IV access, two large bore IV access. You're not going to wait until the doctor come. In the US, they put up the IV access. So all these are nursing duties that you need to know. And you need to prioritize. So say, for instance, they would probably say which action would you prioritize first. You're not going to start an IV access before you put the patient on oxygen. Yes, the IV access is important, but we need to start that patient on oxygen because he's short of breath and he's cyanosed. And that's how you start thinking. So these are some of the prototypes, right? What is it? The case study. It is similar to unfolding scenarios covered today in nursing education. You have the body of information or the stimulus or the scenario that it would give you. So they would give you, for instance, as I said, the patient came into the emergency department complaining of shortness of breath, chest pain, and cyanose and diaphoretic, right? Followed by 6 related questions. So each question tests an important element of the clinical judgment model. So they would look at the assessment, they would look at the diagnosis. Someone's mic is on, right? Right? As you review the sample provided, you are able to identify the connections to real world scenarios and provide the safe and effective care. All right? So NGN again is real world nursing situations, and it measures your ability to identify, analyze, and synthesize the relevant information and into the appropriate nursing interventions and prioritize them based on the client's need and select and perform correctly and evaluated for effectiveness. Somebody's mic is on. So the case studies here would always include 6 items, and the order of the items will match the order of the sample set. And the case studies will include multiple tabs of information.
Are you coming?
In the clinical judgment, again, it's case studies that are associated items that reflect their nursing situations similar to what you would see in the classroom as well as in clinical practice. However, it is not enough for NUGEN NCLEX to appear to measure important material. So the NCSBN has worked for more than a decade to ensure that the NUGEN provides evidence-based means of measuring clinical judgment in nursing. So remember, they did this assessment way down in 2015. Right? And they only brought it on in 2024. All right, so we're going to look at a video. Any questions so far? All right, so we're going to look at a video about the NUGEN case studies.
Hi, I'm Melanie from UWorld. We're looking at next-gen practice questions from the UWorld question banks. Alrighty, so looking at an actual NGN style case study from UWorld here, what I want to start talking about first is the clinical judgment measurement model. It serves as the foundation for all of this NGN new style content. So here we have, this is kind of a mock-up to make it easy to understand what this means. But to really understand it in depth, there's a link over here you can go to the NCSBN website, and they are the ones who created the clinical judgment measurement model from the NCSBN. So here we kind of have a little on the green and blue side on the left. You can see that this is what, and we want to focus on the word measurement here. So they created this to help measure nursing students' clinical judgment. And so that's the basis for the NGN content. Now, if you look over on the right side, you can see that it kind of like follows the nursing process in a way, but the nursing process, of course, is focused on like, what do we do as nurses when we're taking care of patients? Whereas the clinical judgment measurement model is testing how well you can move through these steps in making decisions at the bedside. So starting at the top, recognizing cues just means like, can you notice the stuff that you need to notice to make decisions? Analyzing cues means that like, can you take those pieces and pick out what's important and put it together? Prioritizing hypotheses is taking that information, putting it together, and then deciding what's most important here. Generating solutions is then, what can I do about this? Taking action is, let's do it now. How do I do it? And then evaluating outcomes is, did it work? Should I do something different? And then we kind of just continue in this continuous cycle, just like the nursing process. It goes as just a continual loop of like taking care of your patient is like checking things out, intervening. Did that work over and over again? So it kind of mimics that, but the purpose is different. This is for testing understanding of clinical judgment. So with that in mind, when we look at a case study itself, the idea is that each question in the case study is going to try to hit one of these steps so they can measure how are you doing as a student matching up with each of these steps of the clinical judgment measurement model. Are you hitting each of these? Which is why you can see here that this is a 6-step model and there's 6 questions in a case study. So let me flip over. So the nurses notes tab here gives us some good information to start with. We can tell they're in the emergency department. It tells us that it's 8 a.m., 800 hours. That may or may not be important. And then we can see here the client has come in due to fear of having a heart attack. Heart attacks, of course, are, one of the most emergency conditions you can walk in with. The client states, I was taking a bus from home. We'll just kind of read it over briefly here. Chest tightness, they had some help, and there's some fear here of what happens next time if they can't find help. And then they're saying that they have had some similar experiences recently. It's kind of random, and they're afraid of what's going to happen if it happens again and if they'll have help. So then looking over, of course, we have a lot of clinical data here. So we're going to go from the nurses notes tab and make sure we're looking at all the information. Here's the history and physical tab. This has a lot of helpful information in it. So these are typically written by your healthcare provider here. And this is going to tell us a lot about their physical symptoms. So generally, we can see that this client, even though we're not looking at them, we can tell from the notes that they are well-groomed, taking care of themselves, but having some minimal eye contact and appearing fidgety, tearful, flat affect, which is something that can be associated with depression, some other conditions. So definitely maybe some mental health issues here we want to be sensitive to. The client is trembling. The thought process is logical. That's helpful to know. And no reports of suicidal or homicidal ideations. That's great. Definitely something we want to always screen for with mental health concerns. Cardiovascular is important here because they're reporting chest tightness. We've got random episodes of chest pain, some dizziness, which could be, a concern for perfusion if they're being dizzy. Shortness of breath, heart palpitations that have been happening and stopping over a few months. Spontaneous resolution of pain. They're having some weight loss, which there's a bunch of different reasons you could have that. Thyroid issues or just depression or other mental health stuff. And then we see here they drink alcohol socially. That's not something that's jumping out to us. The client reports having a glass of wine with the evening meal yesterday. So none of that's really jumping out for psychosocial there. And then just making sure we don't miss anything. Here's the vital signs tab. So this patient right now, same time, we can see it's also still 8 a.m. here with this note. Temperature's 99, a little bit elevated, but I wouldn't say they're febrile right now. Getting close to tachycardic here, but could be due to anxiety. Respiratory status is totally fine, 1898 on room air. That's great. Blood pressure is great. So now we kind of have this picture in our head of how they're doing physically and mentally. Let's go over and start looking at the questions. So this is the first of 6. Which of the following findings requires immediate follow-up? And then we select all that apply. One of the nice things about this item is that it's actually a traditional item. You've seen these items before on your tests in nursing school, and as we know, the questions that are inside of a case study can be any item type. They can be some of those newer ones, which are a little intimidating, or they can just be these traditional items that you're used to seeing. So that's kind of nice here, because this is an item that we've seen this before. So let's go through one by one, and we can see here this word immediate is bolded. So we're not talking about like, hey, yeah, we want to make sure that they're going to discharge with this information. We're focusing on what's going on right now. So let's pick out those cues here and see what we find. Select all that apply. So chest tightness, absolutely. That's something we want to follow up on right now. There's some scary things that are related to chest tightness. Flat affect, that's definitely a concern for like a mood disorder, or there's some other neurological disorders that can cause that, but like, is that my primary focus? Maybe not. Heart palpitations, that's another cardiac. When we're thinking ABCs, that's way up there. Minimal eye contact, that also feels like a mental health issue that we definitely want to follow up on, but like right now, it's probably not our highest priority. Shortness of breath, absolutely. ABCs, this could be perfusion, it could be because of a respiratory issue. A lot of reasons that this can be scary. Weight loss, this has been over the first, or I think it's at the last couple weeks or some extended amount of time. So this is not our primary concern right now. So go ahead and hit submit. Now, because this is a case study, in our study product, you're not going to see the answers right away, because the answers are the answers to the question and the explanation, because that would just totally give away the next question. So we're going to hold off on that and come back to it, because we definitely want to learn from what we've answered this question with here. So moving on to the next one. So item number 2 of 6, and we're looking over here. It doesn't say that there's new exhibit information, and we can see over here that it's the same 3 as before. Sometimes they'll add a new time interval here to the nurse's notes or the vital signs. They haven't done it on this situation, and if they had done it, they would have told us over here. So we don't need to look at the notes again. We can just focus here on what the item looks like. So one of the newer NGN item types, this is a multiple response matrix item. So going into this question, we know that it's multiple response. So I could go ahead and I could click every single answer, trying to get as many points as I could, but they would knock off points for the incorrect answers. So we want to focus in and make sure we're only clicking the correct answers, because they're going to subtract a point if we select the wrong ones. So looking at it, the best way to think about it really is column by column. So let's just focus. Here we're comparing hyperthyroidism, myocardial infarction, heart attack, and then panic disorder. Let's go one by one, starting with hyperthyroidism. What are the findings that would be associated with that? It says here they may support more than one disease process. So we know that diaphoresis, it doesn't just end up in one of these spots. It could be on all 3 of them. So diaphoresis, meaning sweating, definitely with hyperthyroidism, they have hot flashes, they have poor, they have more sensitivity to heat and poor ability to cope with the heat. Like if they're outside in the summer, or they're just in a situation that's giving them a lot of heat, they don't cope with that very well. Trembling hands, absolutely, that's related to hyperthyroidism because of the hormone imbalances. And then also heart palpitations here absolutely is related to one of the thyroid conditions. Sometimes I feel like I get hung up on hypo versus hyperthyroidism. Hyper here meaning a lot of extra, so they have hyper extra thyroid hormone. And when you have extra, you're more stimulated and you do have heart palpitations. So we want to click that one. And I believe shortness of breath is also that one. I'm kind of, I need to think about that some more. So let's move on to the next column, myocardial infarction. Diaphoresis is absolutely one of those subtle signs that people don't always realize. A little bit of heartburn and some sweating, it feels like it's kind of random, but maybe not a big deal. But it's actually one of those subtle signs of a heart attack. So absolutely, we want to remember that one and recognize that that's one of the appropriate things to click here with myocardial infarction. Trembling hands doesn't feel like particularly characteristic of MI. I'll leave that one off. Heart palpitations, absolutely, this is a cardiac problem. You're gonna feel some flutters and some weird stuff going on. Shortness of breath, absolutely. There's a big issue here with perfusion. When you're having an infarct in your heart, you're not getting that oxygen where it needs to be, and so you're going to become short of breath. And then thinking about shortness of breath here, absolutely that's related. You know, when you're having an infarct in your myocardial tissue, you're not getting perfusion to your heart's not working like it's supposed to be, the blood's not moving forward as well as it's supposed to be. And so absolutely shortness of breath is something that you could see with that, and it's definitely one you want to follow up on. All right, and then panic disorder. So this is more a mental health issue. And so the physiological stuff going on is more related to how these hormones our body is releasing, like adrenaline, how it's affecting us. So it doesn't mean that, you know, shortness of breath, I would absolutely say is related. Does that mean we're having a respiratory problem? No, but we're having a situation where our body is saying like, oh, it's time to panic, it's time to go, something needs to happen. We're short of breath because our body's getting ready to do something because we're feeling that anxiety of panic. Heart palpitations also definitely related to panic disorder. You know, with the flood of stress hormones you're having, a lot of people do report chest discomfort. So they'll have that feeling of like flip-flopping in their chest, and that, you know, we call that heart palpitations. Also diaphoresis, again, similar or related to the same thing. You're going to see some sweating. So that would be related as well. Trembling, I think that's related. I mean, you're feeling really freaked out and people get trembly when that happens. Okay, so then let me just double check what we're missing here. This one's empty. Yeah, it's okay. And then hyperthyroidism, this one's empty. I feel like they might be short of breath, especially because we know that with temperature dysregulation and they do have elevated temperature, shortness of breath is sometimes this thing the body does to kind of compensate for that. So kind of releasing more air, breathing faster, they may feel like short of breath. So I feel like we could click that one and see how we go. So let's go ahead and submit. And again, we won't see the explanation just yet. So we'll move on to the third question. A lot to think about with this. All right, item 3 out of 6. And we can see here that something else has popped up. And then also it tells us right here, the nurse has reviewed the information from diagnostic results and laboratory results. So we want to make sure we're checking out those tabs again. So coming over here, we've got laboratory results. And as we know, troponin is one of the hallmark labs that tells us whether or not somebody's having a heart attack. So here with troponin, it looks like they've tested 2 different types. I don't know exactly the difference, but I know that troponin is a test they do to tell me whether or not they're having an acute myocardial infarction situation. So I can see here, they do give me the reference ranges. So I know that a troponin value here of more than this is going to be concerning because the normal value is less than 0.1. So anything that's above that would be concerning. This person's value is 0.0. So the normal being less than 0.1, we're in that safe range. We've got a normal value for this troponin. And then the same here, they're at 0, the normal is less than 0.03. So I feel like we're really ruling out here heart attack is the cause of this person's symptoms. So again, we're going through the clinical judgment measurement model, we've analyzed the cues, and now we're kind of prioritizing like what is going on and what do we do here? And then we need to also make sure we look at the diagnostic results. So looking at diagnostic results here, the ECG is showing that they're in sinus tachycardia. We already knew they were in tachycardia. We looked at their vital signs and their heart rate was elevated. So, and this is not one of those findings like there's certain, you know, ST segment elevation and other arrhythmia findings that would tell the provider that there's a potential for heart attack here. And they're really the ones to look at that and make decisions most of the time. But here we know at least that this is something we already knew was going on, and it's not one of those hallmark scary arrhythmias that make us think heart attack. So we've kind of ruled out heart attack, which is great. All right, moving over to look at item 3 here. It's asking us to complete the following sentence by choosing from the list of options. So the nurse recognizes the client is at highest risk. So again, we have that bolded word and highest telling us that this is the most one we want to focus on. It's a priority here. That doesn't mean that the other ones aren't potential answers, but we're focusing on the most important here, which makes sense because this is the prioritizing hypothesis question in our clinical judgment measurement model. So highest risk for developing blank is evidenced by blank. So here, let's look at our options and see what we can pick from. So we think they're at highest risk of heart failure, agoraphobia, or thyroid storm. Here with this patient, I think from everything we've read in their history and physical especially, I feel like we're leaning towards a mental health issue with their affect, and then they're not reporting a lot of GI distress that people can have with thyroid issues, like especially, bad hyperthyroidism. So I think we can kind of rule out the heart failure because we already know it's not cardiac. And I think we can go away from the thyroid issue right now. And I think we're
Yes, said 9 and 10.
Good night. Someone's mic is on. Can you turn off your mic?
right now. And I think we're going to focus on the mental health condition. So here I would say the most related mental health condition here is agoraphobia. So I think that's going to be our answer for what they're at highest risk for, because the correct answers, because they're going to subtract a point if we select the wrong disorders that can cause that. But like, is that my primary focus? Maybe not. Heart palpitations, that's another cardiac. When we're thinking ABCs, that's way up there. Minimal eye contact, that also feels like a mental health issue that we definitely want to follow up on. But like right now, it's probably not our highest priority. Shortness of breath, absolutely. ABCs, this could be perfusion. This could be because of a respiratory issue. A lot of reasons that this can be scary. Weight loss, this has been over the first, or I think it's in the last couple weeks or some extended amount of time. So this is not our primary concern right now. So go ahead and hit submit. Now, because this is a case study, in our study product, you're not going to see the answers right away, because the answers are the answers to the question and the explanation, because that would just totally give away the next question. So we're going to hold off on that and come back to it, because we definitely want to learn from what we've answered this question with here. So moving on to the next one. So item number 2 of 6, and we're looking over here. It doesn't say that there's new exhibit information, and we can see over here that it's the same 3 as before. Sometimes we'll add a new time interval here to the nurse's notes or the vital signs. They haven't done it on this situation, and if they had done it, they would have told us over here. So we don't need to look at the notes again. We can just focus here on what the item looks like. So one of the newer NGN item types, this is a multiple response matrix item. So going into this question, we know that it's multiple response. So I could go ahead and I could click every single answer, trying to get as many points as I could, but they would knock off points for the incorrect answers. So we want to focus in and make sure we're only clicking the correct answers, because they're going to subtract a point if we select the wrong ones. So looking at it, the best way to think about it really is column by column. So let's just focus. Here we're comparing hyperthyroidism, myocardial infarction, heart attack, and then panic disorder. So let's go one by one, starting with hyperthyroidism. What are the findings that would be associated with that? It says here they may support more than one disease process. So we know that diaphoresis, it doesn't just end up in one of these spots. It could be on all 3 of them. So diaphoresis, meaning sweating, definitely with hyperthyroidism, they have hot flashes, they have poor, they have more sensitivity to heat and poor ability to cope with the heat. Like if they're outside in the summer or they're just in a situation that's giving them a lot of heat, they don't cope with that very well. Trembling hands, absolutely, that's related to hyperthyroidism because of the hormone imbalances. And then also heart palpitations here absolutely is related to one of the thyroid conditions. Sometimes I feel like I get hung up on hypo versus hyperthyroidism. Hyper here meaning a lot of extra. So they have hyper extra thyroid hormone. And when you have extra, you're more stimulated and you do have heart palpitations. So we want to click that one. And I believe shortness of breath is also that one. I'm kind of, I need to think about that some more. So let's move on to the next column, myocardial infarction. Diaphoresis is absolutely one of those subtle signs that people don't always realize. You know, a little bit of heartburn and some sweating, it feels like, it's kind of random, but maybe not a big deal. But it's actually one of those subtle signs of a heart attack. So absolutely, we want to remember that one and recognize that that's one of the appropriate things to click here with myocardial infarction. Trembling hands, it doesn't feel like particularly characteristic of MI. I'm gonna leave that one off. Heart palpitations, absolutely, this is a cardiac problem. They're gonna feel some flutters and some weird stuff going on. Shortness of breath, absolutely. There's a big issue here with perfusion. When you're having an infarct in your heart, you're not getting that oxygen where it needs to be, and so you're gonna become short of breath. And then thinking about shortness of breath here, absolutely that's related. You know, when you're having an infarct in your myocardial tissue, you're not getting perfusion to your heart's not working like it's supposed to be, the blood's not moving forward as well as it's supposed to be. And so absolutely shortness of breath is something that you could see with that, and it's definitely one you want to follow up on. All right, and then panic disorder. So this is more a mental health issue. And so the physiological stuff going on is more related to how these hormones our body is releasing, like adrenaline, how it's affecting us. So it doesn't mean that, you know, shortness of breath, I would absolutely say is related. Does that mean we're having a respiratory problem? No, but we're having a situation where our body is saying like, oh, it's time to panic, it's time to go, something needs to happen. We're short of breath because our body's getting ready to do something because we're feeling that anxiety of panic. Heart palpitations also definitely related to panic disorder. You know, with the flood of stress hormones you're having, a lot of people do report chest discomfort. So they'll have that feeling of like flip-flopping in their chest, and that, you know, we call that heart palpitations. Also diaphoresis, again, similar or related to the same thing. You're gonna see some sweating. So that would be related as well. Trembling, I think that's related. I mean, you're feeling really freaked out and people get trembly when that happens. Okay, so then let me just double check what we're missing here. This one's empty. I think that's okay. And then hyperthyroidism, this one's empty. I feel like they might be short of breath, especially because we know that with temperature dysregulation and they do have elevated temperature, shortness of breath is sometimes this thing the body does to kind of compensate for that. So kind of releasing more air, breathing faster, they may feel like short of breath. So I feel like we could click that one and see how we go. So let's go ahead and submit. And again, we won't see the explanation just yet. So we'll move on to the third question. A lot to think about with this. All right, item 3 out of 6. And we can see here that something else has popped up. And then also it tells us right here, the nurse has reviewed the information from diagnostic results and laboratory results. So we want to make sure we're checking out those tabs again. So coming over here, we've got laboratory results. And as we know, troponin is one of the hallmark labs that tells us whether or not somebody's having a heart attack. So here with troponin, it looks like they've tested 2 different types. I don't know exactly the difference, but I know that troponin is a test they do to tell me whether or not they're having an acute myocardial infarction situation. So I can see here, they do give me the reference ranges. So I know that a troponin value here of more than this is going to be concerning because the normal value is less than 0.1. So anything that's above that would be concerning. This person's value is 0.0. So the normal being less than 0.1, we're in that safe range. We've got a normal value for this troponin. And then the same here, they're at 0, the normal is less than 0.03. So I feel like we're really ruling out here heart attack is the cause of this person's symptoms. So again, we're going through the clinical judgment measurement model, we've analyzed the cues, and now we're kind of prioritizing like what is going on and what do we do here? And then we need to also make sure we look at the diagnostic results. So looking at diagnostic results here, the ECG is showing that they're in sinus tachycardia. We already knew they were in tachycardia. We looked at their vital signs and their heart rate was elevated. So, and this is not one of those findings like there are certain ST segment elevation and other arrhythmia findings that would tell the provider that there's a potential for heart attack here. And they're really the ones to look at that and make decisions most of the time. But here we know at least that this is something we already knew was going on, and it's not one of those hallmark scary arrhythmias that make us think heart attack. So we've kind of ruled out heart attack, which is great. All right, moving over to look at item 3 here. It's asking us to complete the following sentence by choosing from the list of options. So the nurse recognizes the client is at highest risk. So again, we have that bolded word and highest telling us that this is the most one we want to focus on. It's a priority here. That doesn't mean that the other ones aren't potential answers, but we're focusing on the most important here, which makes sense because this is the prioritizing hypotheses question in our clinical judgment measurement model. So highest risk for developing blank as evidenced by blank. So here, let's look at our options and see what we can pick from. So we think they're at highest risk of heart failure, agoraphobia, or thyroid storm. Here with this patient, I think from everything we've read in their history and physical especially, I feel like we're leaning towards a mental health issue with their affect, and then they're not reporting a lot of GI distress that people can have with thyroid issues, like especially, bad hyperthyroidism. So I think we can kind of rule out the heart failure because we already know it's not cardiac. And I think we can go away from the thyroid issue right now. And I think we're going to focus on the mental health condition. So here I would say the most related mental health condition here is agoraphobia. So I think that's going to be our answer for what they're at highest risk for, because they're having those panics in situations. And it seems to be they were on a bus when it happened. So maybe it's related to being around people. So let's click that as our concern for like a complication or a future problem they may develop. And then as evidenced by blank. So let's see what our options are here. Fear of future attacks, they absolutely have that. We saw that. And then evidenced by chest pain and palpitations. Well, that's definitely related to panic attacks. But if we're trying to support our answer of agoraphobia, that may not be the best. And then here, recent weight loss and loss of appetite. So again, with this type of question, our first blank has been answered. And so the second blank is needing to support what we've answered in the first blank. So we really need to focus on this wording as evidenced by blank. So really what tells us that agoraphobia is going to be the answer? And that I feel like is fear of future attacks, because when you get around a group and you have that anxiety, I think is characteristic of agoraphobia. So I think we're going to go ahead and click fear of future attacks because it seems most related. All right, and again, we'll come back for the explanation here. So moving on, we got question number 4. So we're over halfway there, and we're moving on in the measurement model to the stage of generating solutions now. And then we have this little alert here again that says the nurse has reviewed the information from nurse's notes. So we know they've added more information. There's not a new tab here, but if we scroll down on the nurse's notes, we can see there's a new time frame. So it was 8 a.m. and now it's 9 a.m., an hour later. We're evaluating the client. They look irritable, fidgety, restless, still organized and logical thought process. Anxiety is 6 on a scale of 0 to 10. And then we're giving them a benzo to help with anxiety. So this alprazolam is one of the benzodiazepines. So that's going to help with anxiety. So we're going to go ahead and give them that medication here. And then other solutions we can provide. That's what we want to focus on with this question. What else can we do to help this client right now? So here we're going to say for each potential intervention, click the intervention as indicated or contraindicated. So this is again a matrix item, but it's a multiple choice matrix, which means that there's one answer for every row. So they're telling us, give us one answer in every single row, which helps us understand that they're not going to take away points if we click the wrong option, because they're telling us you need to put an answer at every row. So this is one of those where they give you points for every right answer, but they don't take away points because they've already said, we want 5 answers, so give us 5 answers, please. So just kind of think about that as we go through here. So one potential intervention is encouraging the use of positive self-talk. I think that's appropriate. This person, again, if they're having some mental health issues, could benefit from that. I think a lot of people can benefit from that. So I would say that that's indicated. So we would click this column And I think it's helpful to kind of treat each row as a separate question here. So then we're going to go on to the next one, and it says, ask the client about any recent life stressors. So is it good to bring it up right now? Is it therapeutic to talk about that? I think generally when we read about therapeutic communication, we want to help the client open up about this kind of thing. So I think it's probably indicated. We'll click that. Assist the client to recognize physical symptoms of anxiety. This is absolutely helpful because here we've given a benzodiazepine. If they walk away with a prescription for that medication, they're going to need to know when to take it. So having them understand, like, what is it that's like a precursor, a sign that this may be coming, a panic attack. Can we recognize those signs? So this is really important. I think a great nursing driven intervention here is we want to make sure they can understand when if this happens again. Encouraging the client to spend some time alone when feeling anxious. Oof, that one's tricky. Should they be alone when they're anxious? If we're considering agoraphobia, that one's kind of difficult. I don't think we want to do that. I think we want to encourage support systems is what we usually read about in our nursing textbooks. But then again, if they're going to be agoraphobic, I'm not sure about that one. I think being alone can be relaxed. Let's click indicated. Not sure. And then reinforcing abdominal breathing exercises to use for anxiety. That's very much something that's appropriate for most people. So this is a great situation to use that intervention, which I think is why it's an important option here, because this is something they can do when they're feeling that panic coming on and the medication maybe isn't available or they haven't taken it. And this is something they could sit down and do. And if we teach them this, then it can help them in the future. So I would say that's absolutely something we want to do. So we answered all 5 rows. Perfect. Move on to the next one. All right, item number 5, 6, we're getting close. It says the nurse reviews information from nurse's notes and vital signs. So we know we've got some more information to look at. Let's scroll down further on the nurse's notes. It says here, a couple hours later, the client rates anxiety as 2 on a scale of 0 to 10. That's great. So we've come down from a 6 to a 2, and they want to go home. They're ready to go home. The client is referred to an outpatient mental health clinic for follow-up. That's perfect, because it is the nurse's job, absolutely, to make sure that we're not just, hey, here's a Band-Aid, now you can go home. We want to make sure that this chronic condition is going to be carried through with further treatment. So we want to make sure, hey, do you have the phone number for the clinic you need to go with? Do you have an appointment set up yet? This is something, when you're discharging a patient, this is the nurse's job. You need to make sure that this is happening. So here we say the client is referred to the clinic. Perfect. We can check that box. And then our other new information that we got here was under the vital signs. So we can compare the 8 a.m. vitals to the 11 a.m. vitals and see that with the anxiety going down, things have really normalized here. The respirations have gone down. They're still satting really well. Everything else is getting much more normalized, which is great. Which is another good indication that they are getting close to ready to discharge. All right, so looking at the item here, we're saying the nurse is reinforcing teaching about newly prescribed medications. So we've got alprazolam, which is again that benzodiazepine, which helps acutely with anxiety. So you take that when you're really feeling the symptoms. And then sertraline, which is going to be a long-term medication that you take scheduled at the closest time possible every day to reach a steady state of that medication in your bloodstream. It's an SSRI. So it's an antidepressant. It's going to help with depression, anxiety. So we've got 2 new medications. They're similar in the category of treating mental health, similar in that way, but they're taken very differently. So we need to say here, we need to read here, which of the following statements by the nurse are appropriate to include in the teaching? So what do we say to our patient here to make sure they understand? Select all that apply. Again, this is one of the older item types, so that's helpful because it's not one of the newer, more intimidating ones. For option 1 here, it's saying avoid driving after taking alprazolam. That's a great thing to teach about. It is definitely a nursing intervention because it's very safety focused. If you take a benzodiazepine and then get behind the wheel, there's this risk of that sedative side effect causing an accident. They usually talk on the prescription bottle as well. They say, you know, don't drive or operate heavy machinery when you're taking this medication because it's dangerous. So this is something we want to drill in and make sure they understand that if you take this medication for your anxiety, it could make you sleepy, and then it could be dangerous to drive a car. So we're going to click that one. And then contact your healthcare provider immediately if you experience suicidal thoughts. This is very important. As we all know, when you first start taking an antidepressant, you can quickly get to this period of like, you know, kind of euphoric, you're feeling more energy, you're feeling better, which is great. But if you're still kind of depressed, this can lead you to have more energy to act on a potentially suicidal action. So here, and this is particularly relevant in the younger group of people, that's when they see it more. So this patient's 21. So this is something we absolutely want to make sure gets across, is that you're taking a new SSRI, there's this potential for this, you know, very devastating complication here. So we want to drive home that, hey, if you're starting to have those suicidal thoughts which happens kind of in that initiation period of taking the medication, contact your healthcare provider, because that's not normal. It's not a long-term side effect of the medication. So they really need to know that right now to look out for that. So we definitely want to cover that with this patient. Do not abruptly stop taking alprazolam because you may experience withdrawal. That one is true. That one I'm less confident on. Let's click it. Limit alcoholic beverages to no more than 1 drink a day while taking alprazolam. That one's a little tricky because I think they're not supposed to drink at all when they take alprazolam. But limiting is good if it's a concern, because both alcohol and this benzodiazepine are going to be sedating, which is why we're concerned about it. I'm not going to click it because I'm wondering if they shouldn't have any. So instead of 1, it should be none. So I'll leave that one off for now, but I'm kind of hung up on it. We'll see. And then option number 5, take sertraline at the onset of a panic attack. That's wrong. We know that SSRIs, like I said, they need to be taken at the same time every single day because they help prevent. So taking this, you may be taking too much of it, which can cause complications if you're taking it right at the onset of a panic attack. So that's incorrect teaching for this. So we're definitely going to leave that one off because I feel pretty confident that's wrong. So looking back, we've got 3 selected. This is a multiple response. It doesn't tell us how many to click, which means that if we get an option wrong, they're going to count off a point. So I really want to be careful here. Limit alcoholic beverages. Since I'm on the fence, I'm not going to click it because I don't want to lose a point. All right, submit. All right, moving on to the last question here in our case study. It doesn't say we've gotten any new information. I don't see any new tabs over there. So I think we're looking at a future time interval. So the client returns to the mental health clinic for a 1-month follow-up visit, which is great because I love it when we can also see, like, what is this looking like long-term? Which client statement would indicate that the client requires additional therapy to cope with panic disorder? So this is a single best question, so there's only one right answer, which is really helpful. Let's read here. I realize that my panic attacks are under control. I'll eventually need to be tapered off. I purchased a watch that alerts me when my heart or respiratory rate increases so I can begin breathing exercises. That sounds like good. I'd say they don't need additional therapy if they're doing this. That sounds like something they should be doing. Probably helpful. My support group has been helping to identify when my thoughts are not realistic so I can talk myself out of feeling the panic. That's really helpful. I mean, having someone else help you realize when you're spiraling is great. So I don't think that needs additional therapy. I think that's great. I think maybe they're doing well. Taking the bus has been a trigger for me, so my boss is letting me work from home. While that may not be their ideal, we don't want them to necessarily have to sequester themselves at home because of their medical condition. So that may mean that there's opportunity for them to progress more. I mean, it's great that their boss is being flexible, but is that what they want long term? Taking the bus. This is kind of one to mull over a little bit, trigger for me. Yeah, they're having to request accommodations from their job because their mental health condition is holding them back. So I would say that this is something that maybe they could progress with. So I think that's the right answer. We'll go with that. So we'll submit, and then we can finally see the explanations, which is great. Let's go ahead and move
We'll be back in
backwards
a few
though,
minutes
because
now,
this is
just
item
finishing up
6 of 6,
orientation.
and we want to see all the explanations.
Okay.
For UWorld, we have them, of course, for every single question. So we can go back a little bit and see, here's the explanation for this. So we'll talk through why every single option's right and wrong. We got scored 3 out of 3. That's great, because this is one of those where we could have gotten points knocked off and we didn't, which is awesome. If you want to know more, you can click this little thing, scoring rule. There's a little infographic about how that works. We did great for this one. For our multiple response matrix, I think we got them all right. And this is another one where you could have gotten points knocked off. So there's that same scoring rule information there. And it tells us 11 out of 11, we got the max points, which is great. Item number 3, again, both right. This is a 0-1, which means that because they told us we had to have 2 responses, they weren't going to take away points, but we got both points, which is great. Another matrix. Okay, this one I think we hovered over for a bit. It is, let's see. So this was wrong. So the correct answer was contraindicated. Okay, so they're not supposed to be alone when they're feeling anxious. They're supposed to reach out for a support system. So, but they told us we had to have one answer for every row. So they're not going to take away points, which means that we got 4 out of 5. So 1, 2, 3, 4, and they didn't subtract a point even though we got that one wrong. So 4 out of 5, that's great. And then number 5 here, another SATA, we got 3 out of 3, which is great. So overall, we did pretty good for this case study. And then when you are studying and taking your time, obviously we want to highly encourage you to go through and read. Even if you got the answer right, why? Like understanding the why behind the correct and the incorrect options is really that learning opportunity here. So as you work through these, I would definitely encourage you to start again from item number 1 and read your explanations, because that's where the learning is really going to be reinforced. And that's it for this case study. Whether you're taking the current NCLEX or the next generation NCLEX, Hi, I'm Melanie from UWorld. We're looking at next-gen practice questions from the UWorld question banks. All right, jumping into the bow tie item here, we can see that this one's unique in the shape of it and then also the way that you interact with it. You actually drag options from down below up into this shape, and they're calling it a bow tie because it does kind of look like a bow tie. In the center, you're picking out one answer option, and then you're going to put 2 on the left and then 2 on the right. It's almost like a concept map, kind of. So this is the basic structure of it, and it will always have these kind of directions at the top that say complete the diagram by dragging from the choices. These little words inside of the boxes you're dragging to can change. This is one that we've seen a lot, so this is what the example is based off of, but they can be different sometimes. So thinking about the bow tie item, this is actually a standalone item for the NGN exam coming up. We've looked at individual item types, which can be used in case studies. We've looked at a case study as a whole in other videos, but in this particular case, a bow tie item is a standalone item where you'll get a scenario, and this is the only time that this item type cannot be in a case study is a bow tie. So you'll get the scenario, you'll analyze it, and then you'll answer the whole item by dragging options into this bow tie diagram. So it's still trying to cover every step of the clinical judgment measurement model, which I'm going to pull up here. I talked about this in another video, but this is the NCSBN's model for how do we actually measure that the student, the future nurse here, has solid clinical judgment. So if you look at it, you can see that it kind of aligns with the nursing process a little bit, but really the clinical judgment measurement model is focused on measurement. So what we're seeing is if the person who's answering the question can pick up on the cues that they need to be paying attention to, like, oh, they have a fever, and then analyze the cues of like, what could that fever mean? Prioritize hypotheses. So like, oof, it could mean sepsis. So that one would be our first priority. generate solutions. What could we do about it? Take action. How do we go about doing that? And then evaluating outcomes. Did that work? What else do we need to do? And then it continues on in just an ongoing circular process from start to finish over and over again as you care for clients. You do things. Did they work? Let's start over, recognize cues, decide what we need to do from there. And it kind of mimics the nursing process, but the nursing process is focused on how are you thinking as a nurse, and the clinical judgment measurement model is focused on measuring how you're thinking and if you're doing an effective job of like making those clinical decisions. So with that in mind, this one is not an entire case study. It's a single item only, but the goal is still to test whether or not you can go from top to bottom, recognizing cues, intervening, and then evaluating outcomes afterwards. So we'll kind of think about that as we look at the bow tie item, that they're trying to evaluate us on every step of this within one item. So let's go ahead and pull up the rest of the item here. So this is just the blank form of it. And again, this is the same words in the boxes that were on that other screen, but you can see here where it has the option wells is what they kind of sometimes call them, the option boxes. And then the way that you answer these questions is by picking things up from these wells and dragging them into the target boxes. So you can drag green boxes into the green boxes. You can drag blue boxes into blue, and you can drag purple into purple. So they line up in a vertical column. You can drag these up and you can drag these up. You can put them in there, change your mind and pull them back down and go back and forth. But you'll be kind of focusing on how this here says actions to take. And so they're going to go in the action to take boxes. So that's kind of the format of it. And so I'm going to go next to an actual realistic NGN style item that UWorld has put together. So here you can see it looks familiar to the other NGN items because it has the clinical data on the left side. So you'll have your nurse's note, and then you'll have your vital signs tab. So let's go ahead and read a little bit about this patient here. It's a 28-year-old client. They've come in, it looks like some abdominal symptoms. They're in the emergency room, 2 days of cramping, abdominal pain, some watery stools. 4 to 6 per day is quite a bit. They're losing fluids there, which can be dangerous, fluids and electrolytes. The client completed antibiotic therapy recently, which means that their GI flora could very much be out of balance. Like, especially when you take antibiotics, it can throw off your GI system, which is why diarrhea can be a common complication from antibiotics because it's throwing off those microorganisms that typically live in your intestines and do the healthy stuff they need to do. It can kind of accidentally kill those off too while it's treating your infection, and then you end up with GI upset. And then also for female clients, it can cause some vaginal infections because it throws off the vaginal flora as well. So that's something to definitely think about. We've taken antibiotics 5 days ago. Like, could that have caused a complication related to changes in the microflora of our body? Let's see what else. No chronic medical conditions, no medications routinely, and no allergies. They haven't had any nausea, and they've had no blood in the stool, which is great. Abdomen is soft and tender all over, but no rebound tenderness, which is great because that rebound tenderness makes us concerned about peritonitis, which is very acute abdominal condition that can make them septic very fast. So we definitely want to keep an eye on that, but it's great that they don't have rebound tenderness. Next, we want to check our vital signs tab. And here, the same time interval, we can see that they're having a fever for sure. That's not good. Pulse is elevated, which oftentimes goes along with a fever, but it can also mean dehydration. And this person's losing a lot of fluid through the diarrhea, and their blood pressure's kind of dipping down, which also can be related to that fluid loss. Respiratory status looks great, so that's good to know. All right, looking over here at the diagram now, we'll take those pieces of things that we noticed and try to put them together and analyze these cues to figure out what's going on with this person. So over here, we kind of talked about this, but the way these work is these little options that you have here, you can click on them and then drag them up to the box above. And then if you change your mind, you can take it and drag it back down below. So you pick it up by clicking and then drag it over. So that's the way that you interact with this, this question type. So let's start in the middle, though, I think is the best place to start. It only needs one answer, and then it influences what we do on both sides. Because the center one is asking us what condition the patient's most likely experience. And so we have to think through everything we just read. Gastritis is very much associated with abdominal pain and irritants of the stomach. Thinking about it, they're having a lot of lower GI symptoms with the watery bowel movements. They're not having nausea, and they're not reporting specifically. I'm trying to read again. Cramping, pain. They're not reporting that upper gastric pain kind of higher, which is what we expect with gastritis. Pancreatitis is that very, very painful condition, and it's definitely associated with fever, so that's interesting. Ulcerative colitis here, that's one where we really look out for like blood in the stool and pain. They have no blood in the stool, so that kind of helps us think that maybe that's not what's going on. And then C. diff infection. This word has kind of changed recently with the scientific classification. It used to be Clostridioium, and then you notice here that it's Clostridioides. I'm not the best at pronouncing it, but it has changed. But most people still call it C. diff. So that's a C. diff infection, which we all know is a complication that often happens, or when it occurs, a lot of times it's related to antibiotic therapy, which is again impacted your gastrointestinal flora. So I think that would be kind of where I'm leaning here with this person, especially with these watery bowel movements. Watery bowel movements are like iconic C. diff. So we definitely are thinking that cramping. I'm trying to think through. They don't really have that pancreatitis presentation that I think of, even though they're pretty febrile. I think I'm going to go forward with C. diff. So we're going to, again, you click on it and then you drag it up here to the center box. So it'll appear there, and then it disappears from this list. And you can still change your mind and move it back and forth if you want to. So now we've decided C. diff. This is what we're treating here. This is what the patient has going on. So we've recognized, analyzed the cues, prioritized what we think is happening. Now let's start generating some solutions and deciding how we're going to accomplish interventions here. For someone with C. diff, I think the first thing that comes to most people's mind is contact precautions. This is something we talk about all the time. C. diff needs to absolutely be on contact precaution. It is easily spread and it is hard to treat. The bacteria changes over time and is no longer responsive to certain antibiotics, so it can be very dangerous. So we definitely want to look at contact precautions. So I think I'm feeling C. diff. I think I'm picking out contact precautions and going to put it up here. All right. And then now that one, which I feel really confident about, is out of my head, let me look at what the other options are. NPO status. I can definitely see that with pancreatitis. That's kind of really important to give the pancreatitis, or to give the pancreas time to rest here. Antibiotics, that is definitely important. C. diff is a bacteria, so we treat it with antibiotics. Immunosuppressants, that one to me more matches with ulcerative colitis because it's an immune-mediated condition. And then here we have a proton pump inhibitor, PPI, which we all know is one to reduce acid in the stomach. So I think that one is probably matching up with gastritis. So it's interesting the way that for this question, a lot of the options kind of match with other conditions. So it helps us kind of rule them out. But I think for this guy or girl with C. diff, they need antibiotics. I feel really confident about that. They've got a terrible infection is what we're thinking. So they need some antibiotics to clear that up. So we're going to drag it and put it up here. All right, we've picked our actions out. We've got our condition decided. Now we got to figure out evaluating outcomes. So we need to know, like, what are we monitoring for this person to see if our interventions are effective or to see if they're having complications from their condition or from our interventions. So looking over here, bloody stools, I think we already talked about, is really related to ulcerative colitis. It is dangerous, so maybe we want to look at that. Lipase, lipase is always elevated in pancreatitis, so I think that's where that's coming from. But I know that we need to measure some blood levels of electrolytes, at least, with C. diff. Abdominal distension can be a side of peritonitis, which is a potential complication of C. diff that is very dangerous. So that one I think is kind of standing out. Coffee ground emesis is caused by bleeding in the GI tract. So that one I think more of a gastritis situation. So probably not that one. Serum electrolyte levels, again, they're losing so much fluid that I worry about if their potassium and sodium and other electrolytes are okay. Starting off, let's definitely do abdominal extension. I feel confident. So you'll click it and then you'll drag it up and it appears up here. And then for the other one we wanted to monitor for, I know I want to go with a lab level. I'm trying to decide, there's 2 lab levels. Let's go with this top one. I mean, these in the middle, let's just go with this top one. So I'm going to click it and I'm going to drag it up here. And then that's all your answers. Again, you can move them back and forth if you want to change your mind, but you've got all the blanks filled. It won't let you progress until the blanks are filled. So got to make sure you do that. And this is one where they told you, hey, I need you to fill in every box. They've told you how many answer options they want you to provide. So they're not going to subtract points from you for clicking wrong options because they told you you had to fill in every box. So let's go ahead and click and see our answer or scoring. So for this one, we got 1 point for each of our correct answers here. We got the right interventions, we were right at C. diff, and definitely we want to monitor for peritonitis here. So that was great. We got absolutely 4 points here. This one, I clicked the wrong level that we're supposed to be monitoring for. I think it's definitely electrolytes. Like I said, they're losing a lot of fluid. That makes sense, but I put LifeSpace up here, got tripped up. But because they told us we had to fill in the box, you're not losing a point from this. We did what we were instructed, and so we get 4 out of 5 points. We're not being subtracted a point there, so that's great. So bow ties, I think they're kind of fun. It's unique from other standalone single NGN style items because it is asking you to go through every step of the clinical judgment measurement model from top to bottom inside of one item. So it is pretty unique and fun to answer. You'll see them potentially later on in your NGN style NCLEX if you take it after April 1st. The first 85 items you get will not contain those NGN style standalones, but you can see these later on in your exam as you progress past item number 85. So these may be in your future, and there's lots of them going to be available on UWorld to practice with. So that wraps up today. Whether you're taking the current NCLEX or the next generation NCLEX coming on April 1st, 2023, practicing NGN questions will help you prepare for the exam and bedside practice. Visit nursing.uworld.com for more information and to see our options for RN and PN, and to start practicing today. Hi, I'm Melanie from UWorld. We're looking at next-gen practice questions from the UWorld question banks.
Okay, so that comes to an end of the presentation. Any questions? Anyone have questions?